Hello and welcome. This is a discussion panel to create awareness on the roles of oncology pharmacists in the cancer space in commemoration to the World Cancer Day, which was celebrated on the 4th of February. That was 2 days ago. And I have with me in the studio here to throw more light on that. Please do us the honors to introduce yourselves.
Pharmacist Clara Adesola. I work in National Hospital.
Okay. Pharmacist Mshellia Richard. I practice with the National Hospital of Abuja.
Okay, you're welcome to the program. Before I go ahead, let me introduce myself. My name is Victoria Gaji. Welcome again. Briefly on what cancer is. I know cancer is common with us, but there might be someone there who really doesn't understand what cancer is.
Cancer is a group of disease that is characterized by continuous replication of cells. The cells get abnormal and then they replicate fast, and before you know it, the organ or tissue affected gets really enlarged. And this can be in any part of the body. Any tissue or organ of the body can be affected.
Okay, World Cancer Day was just 2 days ago, and the theme for this year is Close the Cancer Gap. Can you please throw more light on that?
Well, what it's talking about basically is what the barriers. How do we overcome the challenges or barriers to accessing medications, care, and services for cancer for the patients that are in rural areas, in other places, or do they have the means or the availability of the drugs or services close to them? So the whole concept of closing the care gap is to see how they can bring everybody on table to see that the challenges or barriers that patients face or the hospitals face concerning cancer treatment is narrowed, or at least if it's not erased. So it's just to close the gap.
Okay, I was going to ask, do we have more than one type of cancer?
There are various kinds of cancer. Any organ or tissue in the body can be affected. So as long as the tissue organ is made up of living cells, the cells at any time can just go what we call mutation, get abnormal and start replicating faster than usual. That is when cancer occurs. So it can affect any part of the body. And there are various types. You can name it from the head to the toe.
So do we have any prevalence in Nigeria?
Yes, in Nigeria, it's also a reflection of what happens in the whole world. Among women, breast cancer is most prevalent, followed by cervical in Nigeria, while among the men, prostate cancer is the most prevalent all over the world.
Okay, do you want to say something?
No, I think she has really said so much into it now. Yeah.
Okay, we are here to create awareness on the roles of oncology pharmacists. Who is an oncology pharmacist?
Oncology pharmacist is a pharmacist who is one of the professionals in managing cancer. The management of cancer is actually described as being multidisciplinary. And what that means is a number of professionals, health professionals, are involved in the treatment and management of cancer. Pharmacist is one of them. And to become an oncology pharmacist, you have to be a pharmacist to start with. And then additional training that qualifies you as an oncology pharmacist.
Okay, let this go to you now. At least she has been the one talking, so let's hear from you now. What, in your own experience, what are the biggest barriers to accessing cancer medication in Nigeria?
Okay, in my years of practice, I see the cost of medication to be one of the biggest barriers to accessing cancer medication. Cancer drugs are prohibitively very expensive, even for the rich. I can say that most people have to sell, not to scare people though, that it's expensive, but it's treatable. But even rich people have to sell some of their properties to afford the care.
Oh.
So it is really, the cost of the drugs are really high. And I feel for me, is one of the biggest challenges we have. Yes.
What can we do to address these challenges?
There are a number of things that can be done. In fact, everybody is a stakeholder in this matter, not just the patient or the caregivers, healthcare professionals. The government has actually done a lot in the area of trying to subsidize or even alleviate the financial burden on the part of the patient living with this disease. A number of programs and strategies are in place. For example, we have institutions that have been approved to be centers of excellence in the management of cancer. National Hospital is one of them. There were 7 of them initially. In 2021, 12 others were actually approved. So where they can go and access care. And then in the management of cancer, the burden, like I said, government tried to kind of alleviate it. There are a number of strategies. For example, we have the NCAP, that is the Nigerian Cancer Access Partnership.
Okay.
Under this program, a number of cancers can be assessed. There are over 30 drugs that have actually, I would say, subsidized. Patients are able to save up to 50% of the costs of managing these cancers if they're able to key into that program. Other programs include the CHF, Cancer Health Fund,
Okay.
that the federal government has provided ₦1 million in every patient, indigent patient wallet where they can access. And whenever they need care, they can access it, in helping to alleviate the financial burden. Then there are NGOs, non-governmental organizations, that are also involved as stakeholders in assisting indigent patients in caring for this condition. We also have the NHIE, the Health Insurance Authority, that have also tried to assist, particularly in innovative drugs that we call targeted therapies, try to make the costs really affordable for the patient. So there are various ways put in place to help, even though we are still begging the government to do more for our patients.
Okay.
Just to add to it, please.
All right.
One of the things government, I think, have done, though it's not the topic, but is in the area of prevention. Cervical cancer vaccine, which has not been on the national program of immunization, is now part of the program, and it's really, prevention is one of the key ways of stopping the spread of the cancer if you are able to prevent it and create awareness about it. So that particular cervical cancer vaccine inclusion on the MPI is a very important step towards capping the spread of cancer in Nigeria.
Okay, Mr. Richard here made mention of the cost of drugs as being one of the challenges as part of his experience. And you just mentioned a lot of programs that the government has been carrying out to assist cancer patients. Does it mean it's not effective, or should I just ask, how effective are these programs?
I would say they are, although there are challenges that still exist. Cancer treatment is quite pricey. So the challenges include getting everybody on board. And for us to appreciate that, we will need to understand how heavy the burden of cancer is.
On the individual,
not just
on the government or
global
the society.
Good society level. Globally, in 2020, the statistic has it that over 10 million people came down with cancer, while in Nigeria, over 102,000 persons came down with cancer in 2012. That's the statistics we have for Nigeria, and about 70 died that year. You see how heavy it is.
Yeah.
So it is really a heavy burden, and to get this burden alleviated is not one man's business. That's why we said all stakeholders are called to come on board. Non-governmental organizations have also lent their voices. Individuals have lent their voices to policymakers to see what else they can do to help alleviate this burden.
Okay. These programs, are they nationwide programs, or they are just in the city center in Abuja here, the Federal Capital Territory?
Okay, actually, they're actually a starting program, so they are like a pilot project in centers of excellence. We had 12 initially.
7 plus 12.
7 plus 12, now that would be 19. So when it started, they had centers, at least to cover the geographical regions, at least 2 in each of the geographical regions, but 7 have been. Now there are 19 in number in the nation, in the country, so the spread is going on. So we hopefully it should reach everywhere. So it's not just limited.
How long have the programs been in place?
The NCAP That's the Nigerian Cancer Access Partnership Program was launched in 2019. Of course, before then, people have been living with cancer and have been somehow trying to get themselves treated or managed. So it's been for a long time, and patients have been coping. But government have seen how heavy or huge the body has been over time and have decided to come to assist. And they have promised to even do more. So it's actually all over Nigeria, even though accessibility is still a challenge for some in rural areas. And like the topic for this year is close the gap, the barriers, the inequalities that exist as part of the barriers in accessing this care is being addressed. So we try to increase the awareness. We're on Capital FM. At least an average person in the country can listen to know what to do if they see anything unusual or abnormal. So one of the awareness we try to increase is prevention.
Okay.
Like we say, prevention is better than cure.
But before we go to the prevention, I would like you to talk more on how to access these programs, how individuals, how citizens can have access to these programs.
Okay.
Like, do you just, like, when you go to the hospital and they discover you have cancer, they just register you, or you need to do something special to benefit from this program?
Let me take that.
All right.
Like I said, there are designated centers. For now, the pilot project is in centers of excellence, some selected hospitals. So once you present as a patient, there are certain criteria. One, you must be indigent.
Okay.
Yes, it's not for the rich, not for everybody. And for the pilot project, it's starting with just 3 sets of cancers, not every cancer. So that would be cervical cancer, prostate cancer, and breast cancer. These are the most common cancers based on it. So they can't tackle all. For now, it's just the 3 cancers which have been seen to be very common. So the person must be indigent and must have one of the 3 cancers that are mentioned there. The caregiver will naturally inform the patient that these programs are available for you to key in if you qualify. And the patient, it's a seamless thing, except for 1-2 challenges sometimes with educational level and background and accessibility to internet. If not, I think patients have been seamlessly accessing this. I know a lot of people that have benefited from this program.
Okay, Madam Clara, you are going to talk about the prevention before I interjected. Can you talk more on that?
Actually, prevention depends on the type of cancer. Talking on a general note, one needs to watch one's lifestyle. In the area of prevention, there is need to, like, lifestyle, exposure. When we talk about lifestyle, if someone is alcoholic, if he's obese, the risk, these are risk factors to some kind of cancers. Other risk factor depends on one's kind of occupation. And then, say for breast cancer now, a woman is advised to breastfeed a baby.
Like what kind of occupation?
Okay, like lung cancer, those who work with asbestos or who smoke have been said to have a higher risk. Okay. So to prevent it, they're advised to avoid such. Apart from the fact that some of these cancers are hereditary. So if one knows it occurs in one's family and one exposes oneself to these kind of risk factors, you see, the risk increases. So the risk factors are there that one needs to avoid in order to minimize exposing oneself to the risk of coming down with cancer.
And the breast cancer, you wanted to say that?
Yes. Yeah. A number of factors actually for breast cancer have been implicated, like I mentioned. One is hereditary. If it is in the family line, there are some genes that have been implicated. One could, like in Western worlds, they can check for the presence of that gene in a woman. If she has it, then she knows she's a candidate, likely going to come down with it, and she begins to take necessary measures before she gets old enough to come down with it. Then there are other forms of cancers too that has some risk factor. Like if it's a liver cancer, if somebody has hepatitis, maybe C or B, that's a risk factor. And we have what we call liver cirrhosis. That's a risk factor. So they're advised to get this treated. Cervical cancer is preventable, is curable if detected early. Prevention begins with screening.
Okay.
If they get screened and then there's an infection, they get treated. That can
Okay.
prevent it. We also have like ulcer.
Yeah.
The causative organism is also implicated. If left for too long, it becomes chronic. That can also result in. So there are a number of factors really. So telling people watch out for some of these things, particularly if one notices any form of maybe boil, any part of the body
Yeah, I
bleeding
was
for
going to
no.
ask that. You were talking about prevention, but someone can never be too careful sometimes. So, how do you check to know, okay, this thing that is happening to me might be cancerous? Symptoms that someone needs to check out. That is what I'm trying to
Okay,
say.
to
Mr.
speak
Richard.
on symptoms of cancer, there are no specific symptoms that you can say it is cancerous, but one has to understand his body and have to be a bit more conscious, observant, particularly for breast cancer. If you are someone that is notice that this is the shape and this is how it is, after some time you notice there are changes, and like I mentioned, uh, one has to understand his body. There are lumps that are in the breast that come up at certain periods of the month. That doesn't say it's cancer, but
Like in a
regularly
woman's
it's
breast.
in a woman's breast. Yes, there are
Okay.
lumps that can come up from time to time. It doesn't say it's cancer, but one needs to check for regularity. If this, for any reason, you notice changes that are not so normal, maybe the nipples is going inverted or there is blood coming out from somewhere, these are telltale signs that needs you to present yourself for check. But you should be observant and regularly check yourself. So it's very important to. It can cancer can present as any form of disease, but the most
Okay.
important thing is when it persists, one needs to subject itself to medical experts for them to diagnose. You can't diagnose cancer at home, but
Okay.
yes, but maybe when you are coughing, the cough persists. When you have blood coming out from a particular part of the body that refuses to go, and there's no explanation for it. You are losing weight. You don't know why it's happening. These are things that you need to check with your medical doctors for them to ascertain what it is. It might be cancer, but it doesn't say it is cancer. So
Okay.
it's non-specific.
Okay. You were talking about cervical cancer, and you made mention of the relationship between cervical cancer and infection in women. Can you please say that again?
Okay. Screening a woman, once she attains reproductive age or is sexually active, she's advised to go for what we call pap smear. It's a form of screening for cervical cancer. And at that stage, it could be an infection.
Okay.
So if the infection is treated there and then, she's free. But if she does not go for such screening and it is not picked early, the lesion, we call it lesion, it can progress to becoming maybe stage 1, stage 2. And at that stage, it is still treatable. But once it gets beyond that, it becomes untreatable. And the patient could end up dying as a result of it. One other thing in the area of prevention of cervical cancer is girls between the age of 13 and 19 who are not yet exposed to sexual relations have a vaccine they could take to prevent the papilloma virus. The initial one is to screen for the virus, while the vaccine is for the prevention of the virus. So these two actually are measures we consider preventive measures for cervical cancer.
All right. Back to the medication aspect of it that we're talking about. Are there over-the-counter drugs for
Cancer
cancer
treatment.
treatment? Yeah.
If you talk about over-the-counter drugs, these are simple drugs. I will say no and yes. Yes, we have supportive drugs, but the main anti-cancer drugs are not over-the-counter drugs. These are chemical molecules that only licensed prescribers and licensed pharmacists should handle. If you get what I mean.
I'm trying to
Yeah, the main
like
anti-cancer
you
drugs.
can't just go to a pharmacy and buy drugs because you have cancer.
No, no,
Okay,
nobody
that is
should do
not
that. It's
allowed.
not. It's not.
Okay, you
The
have to
drugs
go to
are
the
strictly
hospital.
prescription drugs.
Okay, and be managed by an oncologist
Correct. That is
pharmacist.
it. No, no, not managed by oncology pharmacists.
Okay.
The management of cancer is actually multidisciplinary.
All right.
Yes, a number of healthcare providers, experts manage them.
Okay.
Amongst them are the oncologists,
All right.
radiation oncologists. We also need other physicians like surgeons who carry out surgery when it's necessary. There are dietitians, just name it.
Okay, what role does vaccines play in the management of cancer?
Okay, vaccine, as you know, they are usually given to prevent cancer. There are not so many vaccines out there for cancer, but there are a few that we know, which is the commonest, which is the cervical cancer vaccine in the prevention of human papillomavirus, which has been directly linked to cervical cancer. People that don't have it, that have been screened and it's known that they don't have this um, disease, are given this to give them a boost of their immunity. Basically, that's what vaccines do. They help your body to sensitize against this. Since it's not that it's a virus, anytime the virus enters, the body is able to take care of it. So vaccines are actually given to help the body boost its immunity against an anticipated entry by any disease. So for cancer, that particular virus is taken care of once the body is immune to it. So vaccines are given to help boost the body's immunity to fight against the virus. Yes.
Okay, and how safe are these available vaccines? Because I once heard someone say that most of the cancer vaccines are not safe. That sometimes when you take them, they result to something else. How true is that?
Not just for vaccine, but any drug that is in the market most times has undergone regulatory, they've done scientific and regulatory work on it to see about its safety and efficacy. So it's just one part to say that it is working and then how safe it is. Before any drug is released, here in Nigeria, we have what we call the National Agency for Food, Drugs Administration and Control, NAFDAC. Outside the country, like in US, we have the FDA. So they make sure that these drugs are not just working, but they are also safe before they are released.
Okay.
Though there were times when early in the discovery of drugs, where drugs were released to the market, then later on they got to know that it has serious side effect on the patients. But on right now, presently, they usually carry out studies to make sure that these drugs, the safety of these drugs are guaranteed before they are released to patients. And the safety of these vaccines at least have been reassured. At least FDA, NAFDAC are the ones that will give us say on that. So if there's any, I'm sure they will have raised an alert on that. They will not allow it into the country.
Okay, and I'm just wondering how many of these cancer drugs are local, produced in Nigeria?
Yeah. I don't have the exact statistics, but not too many of them, I can assure you. Not too many of them. Sizable number actually being imported. And then there are also innovative ones, the ones we call targeted therapies, this one with minimal side effect, and they go straight for the cancer they are meant to treat. Those ones are not yet manufactured locally. They are still imported.
Okay, how available are the drugs? You said something about the government having programs, introducing programs for cancer management, and it's for the indigent patients. So those who may not fit under this program, how do they access these drugs, and how easy is it for them to access the drugs?
They are available to a large extent,
Okay.
even though we have the threat of some of these manufacturers leaving Nigeria for their country. But the world is a global village, you see, so somehow we can get the drugs across.
Rounding up now, what message do you have for Nigerians on World Cancer Day, which was celebrated just 2 days ago? Mr. Richard, please.
Okay, for me, I would just say one, we should try to live a positive life, try to be inquisitive about our health. Our health-seeking behavior should be increased. We should find out if there's anything we can do to help ourselves. Exercise, which is usually underlooked, has been able to help. So lifestyle, I think we should all imbibe good diet, exercise, and lifestyle modification to prevent cancer. Very important.
Okay. Briefly, please.
Okay. Cancer is not a death sentence. Once we notice there's something unusual in our body, doesn't matter the part of the body, please seek medical attention. Get screened, get it detected early, and then cure can be assured.
Okay, thank you very much for coming on the program. You heard
You.
our dear pharmacist here. To stay cancer-free, you have to live a healthy life, exercise, and stay away from junks, I would say. So that is it on the program today. And I've been with pharmacist Mshellia Richard.
Thank you for having me.
You're welcome. And then pharmacist Clara Adesola. Did I get that right?
Yeah.
Okay.
Thank
you very much for coming on the program. I hope you come again when next we'll call on you.
Thank you very much. It will be a pleasure.
My name is Victoria Gaji.